31 people have now died in our country from two mass shootings over the weekend, and a topic that we're hearing more and more about in the wake of these types of events would be mental health awareness. And we're covering this with team coverage for you tonight. To talk about it, our David Chasanoff spoke with leaders at a local organization about the stigma of getting mental health treatment.
And our Nisha McDonald has more on how schools are identifying mental health problems before they happen.
But we're going to begin with David Chasanoff tonight. The president and Ohio's governor have claimed that mental illness played a role in those two mass shootings over the last weekend. David?
The National Alliance on Mental Illness here in Springfield says it's not that simple, though, and it's painful to hear the comparison. So David Chasanoff starts us off. You met with volunteers at NAMI today.
Yeah, David and Heather, two NAMI volunteers say they were frustrated when Trump and Governor DeWine drew mental health into the conversation. They say these claims make the mental health stigma even stronger.
Mental illness and hatred pulls the trigger, not the gun.
Individuals could be subject to a safety protection order if they present an imminent risk of injury to themselves, or they present that risk to another person because of mental health issues.
Two politicians recently said mental illness has a connection to the two mass shootings last weekend.
It's not fair to blame an illness on what happened.
Stephanie Appleby's organization, the National Alliance on Mental Illness, or NAMI, offers peer support to people who have a mental illness. Appleby says those diagnosed with a mental illness, like herself, suffer when people think they are dangerous.
We feel like we have to start all over and go out and reestablish ourselves as professionals, as decent human beings, as trustworthy people and nonviolent folks.
And being considered dangerous is what NAMI director Addie Blankenship says creates the mental health stigma.
Every time someone says something negative about it, that just keeps people from feeling like they can go get help.
Blankenship has the facts to back this.
43% of people who have mental health illnesses go get help. That's, what, 57% that aren't.
Burrell psychologist Sarah Wilson says fewer than a third of mass shootings involve someone with a mental illness. Wilson says the outlook on mental illnesses needs to change.
Not focusing on a single soundbite or policy or event, that will be helpful for all of us to be able to promote those healthy conversations about mental health and access to services.
Wilson says Burrell considers their patients like anybody else. She says that's one way Burrell works to defeat the stigma. Heather?
An important discussion to have. All right, David, thank you.